This video will show you how to correctly use the required personal protective equipment when using transmission-based contact precautions. Transmission-based precautions are used in addition to standard precautions in two situations. The first is when using standard precautions alone may not be enough to prevent transmission of infectious agents. The second is where the infectious agent is a pathogen of concern in healthcare. There are three main types of transmission-based precautions: contact, droplet, and airborne precautions. Contact precautions are used for patients known or suspected of having an infection transmitted via direct or indirect contact, such as Clostridium difficile, Norovirus, or scabies. They are also used for patients who are infected or colonised with a pathogen of concern in healthcare, such as a drug-resistant bacteria like Methicillin-resistant Staphylococcus aureus. For a person under contact precautions, you must wear a gown and gloves. You must put on your gown and gloves before you enter the patient's room. Perform hand hygiene. Firstly, unfold the gown. Slide your arms into the armholes and through the cuffs. Secure the top of the gown at the back of your neck with the ties, tape or Velcro. Grasp the waist ties and tie securely at the middle of your back. Perform hand hygiene and wait for your hands to dry. Choose the correct size gloves and remove from the box. Slide one hand into a glove so it extends over the cuff of the gown. Repeat with the other glove. You must remove your gown and gloves when you leave the patient's room. Using your non-dominant hand, remove the first glove by pinching the inner wrist of the cuff on your dominant hand. Roll the glove down over your hand and scrunch it into the palm of your non-dominant hand. Remove your second glove by placing your fingers under the cuff on the inner wrist and rolling it from your hand and over the first glove cradled in your palm. Dispose of the gloves directly into the waste bin. Perform hand hygiene. Undo the waist tie of your gown. Undo the neck tie, tape or Velcro. Pull the gown away from your body. Pull your arms out of the gown, turning the sleeves inside out. Roll the gown down away from your body. Continue to roll until the gown is in a ball. Dispose of the gown directly into the waste bin. Perform hand hygiene. Occasionally, it is necessary and recommended to use a combination of transmission-based precautions. Please remember to refer to your local infection prevention and control policies and procedures, as well as these videos.